Hey, future medics. Today we are finishing up the appendicular skeleton by doing the pelvis and the lower extremity. Now, these structures are built for weight bearing, stability, and strength, and dysfunction to them can cause difficulties with mobility and circulation. So let's break it down simple so it makes sense. The pelvic girdle is made up of two bones that are themselves made of three bones that are fused together. The ilium is the broad top upper portion. The ischium is the posterior portion, and it's the part that you sit on. And when people say you have a bony butt, that's what they're feeling. And the front part is the pubis, and it's where the two halves join together and connect at the pubic symphysis. Now, all three together form the acetabulum, which is where the femur sits to form the ball and socket joint that makes up our hip. The pelvic girdle is protective of many interior structures that we have, and it provides stability for weight transfer. The femur is the longest and the strongest bone of our body, and it fits into the acetabulum to form a ball and socket joint to form the hip. Now, we're keeping it really simple for now, but this does bleed a lot if it is broken. And we'll go into that in our trauma section. But if you look at how the hip articulates with the acetabulum and then how the femur is formed in the first place, you'll see a skinny little portion at the head, which is the neck. We see a lot of fractures here whenever people fall down because it's where the bone gets a little bit thinner. As we move distally, you'll see it articulate with the tibia to form a hinge joint to form the knee. Now, moving down, we have a patella, which is actually a sesamoid bone. It has no bony joint articulations to keep it in place. It's actually embedded within a tendon, so it can move at will, and this helps protect the knee. Now, just like I pointed out earlier, the lower leg has two bones, just like we saw in the lower arm. So we have the tibia, which is medial, and the fibula, which is lateral. And the tibia is the main weight bearer of our lower leg. The fibula does bear some weight, but not that much. The tibia is actually where we will see insertion for an easy IO, and because it is so close to the surface of the skin and it's pretty superficial, it's not uncommon to see a compound fracture with that tibia. But moving further down to the foot, you will notice that we have those little bones just like we had in the wrist, but in the foot, they are called tarsals. They're not carpals. So the hands have carpals and metacarpals, and the feet near the toes have tarsals and metatarsals. Okay? So in the foot, you have 7 tarsals, 7 metatarsals, which are still those long bones, and we have 4 phalanges and 1 hallux. So the thumb was the pollex, and the great toe is the hallux. You might just on tests see it as 5 phalanges, but if anyone asks you what the specific name for the great toe is, it is the hallux. Now the foot provides stability and also movement for our body. Again, just like I was talking about with the hand, we need to take any injuries here very seriously because losing your mobility definitely affects your life. And we can check this the same way. When we're checking PMS, we can check for cap refill, we can check for movement in those toes, and also sensation at all spots. That finishes the appendicular skeleton. Next, we're going to look at the axial skeleton, which houses the central nervous system. And I know that we broke this down in a way that you can understand, and you're doing a good job. I'm really proud of you for being here. I believe in you, even if you don't believe in yourself right now. I'll see you soon.